Um, and with that in mind, I'm going to get started right now, just so we get to as much content as we can. So welcome to the final session block of the 2020 Visitor Experience Conference. It's been lovely chatting with all of y'all over these last 2 days. We are here to talk about reopening your institution in a pandemic, which is something that probably none of us expected we would be doing, but you know, here we are. We have a few folks who have gone through this process already, and they're going to share their experience with us. Oh, and I should introduce myself. My name is Pat. I am the Marketing Communications Chair for the Visitor Experience Group. In my day job, I work at a small corporate museum in Philadelphia that is actually in the process of closing, so I don't have to worry about reopening. And I've been with VEX since year 2. I was an attendee the first year. I made the mistake of asking them if they were going to do it a second time, and they brought me on board. And I've been here ever since. On our panel today, we have Anna Altschlager, from the Assistant Director of Guest Experience at Old World, Wisconsin. We have Neda Asgharzadeh, Guest Services Manager, Museum of Fine Arts, Houston. We have Justine DeCotis, Senior Manager of Visitor Experience and Systems Administrator at the Boston Children's Museum, and Jason Hinkle, Director of Visitor Services at the Filoli Historic House and Gardens. So welcome to our panelists. Welcome to everybody who's here to listen in. And let's get started with our questions. So for our panelists, feel free to jump in at any point. If we have a little awkward silence, I may call on somebody just to keep the ball rolling. But our first question is, when did you reopen, and what were the circumstances leading up to reopening?
I'll jump in. Jason Hinkle, Director of Visitor Services at Filoli. Reopening was interesting for us. Being in San Francisco Bay Area, we were actually one of the first areas to completely shut down. So essentially, we shut down March 17th on St. Patrick's Day. We were able to reopen May 11th. And with that reopening was a partial reopening. We have a historic garden, open space, and a historic house, which is a museum. We could not open the museum. The visitor center had to be closed because the indoor spaces were shut down, which include our gift shop. We also had to limit the capacity of the property to 50% of what we normally would handle. But we also did it with 40% less staff. I know we've all gone through that one. And even amongst that 40%, some of our full-timers were then part-timers. So it was a very challenging one. We were able to do it. Right before we reopened, we used that time to bring our circle level membership, which is our upper tier, invite them and their families to come visit and try our systems out. So kind of a soft reopening, and had senior staff there to observe, interact, just kind of get the feedback, what they thought was working, what differences they've noticed, and just to communicate all of our processes that we needed to do. And since then, we've actually seen an 8.5% increase with our visitation over last year. So that's kind of our experience.
I can dive in just because we have a similar outdoor-indoor mix as Jason. So I'm Anna Altschlager. I'm from Old World, Wisconsin, just part of the Wisconsin Historical Society. We're a 600-acre living history site. We've got 60 historic structures across the grounds. When we're part of the state, which is an added level of complications. So if anyone wants to talk specifically about the state government side of this, that can be a great side conversation, especially with health and politics as the numbers are now in the great state of Wisconsin. So we actually were in a really interesting point with the shutdown because we are mainly seasonal. We have about 10 core year-round folks, and then we staff up to about 80 or 90 folks in April. And so when everything happened in March, we actually had this weird hiccup where we didn't bring on all our seasonal folks. So we didn't really open for the season. But then we had lots of conversations about marketing and how do we stay relevant and how do we stay connected and how do we nurture that. So it was a mix of social media programming as well as relaunching some type of on-site experience, but we weren't able to bring in any of our seasonal folks. So it was the same core 10 people who now had to stretch themselves to be able to accommodate programming. And we started in July with some small group programs, some behind the scenes, high ticket, high price point items, exclusive access, and then rolled it out into bigger programs and bigger programs, but and we can talk more about it later, but structuring them as COVID proof, because our numbers here, you can't have more than 20. No, now it's 50. Now you have to back to 20. Now it's back to 10. Now it's a capacity. And so we have kept small programs so that we are open, but it's not really open. So it's kind of this gray fuzzy part. And then we just launched a drive-through experience, which has allowed us to get thousands of folks in the door in a brand new way that we've never done before.
We opened at the end of May, closed within 2 days in the middle of March, and then spent about 4 to 6 weeks preparing to reopen. We have 2 full buildings that are art galleries. We also have 2 house museums, historic house museums with gardens. So we had to figure out a lot of indoor, outdoor, how do you treat the spaces, and we were one of the first, or the first major art museum to reopen. Didn't really know that until the news reports came out, like, oh, we didn't mean to be first, but here we are. And some of the challenges were interpreting what guidelines meant for us, coming from state CDC, and then the American Association of Museum Directors put out some guidelines on capacity. And we're still at 25% capacity. We went with the most conservative and from AAMD. And we have a lot of square footage here, so we were lucky in that. And we do see that the gardens have higher attendance as compared to the years before versus the indoor experiences. And we have another challenge next month in that we're adding a 3rd art building, and all the buildings are connected via art tunnels, and we have 5 new entrances. We have to figure out what to do. And we, up to this point, had funneled everyone to 1 entry, but with 3 gallery buildings, it's not going to be possible. So we're redoing, reassessing, and figuring out flow and where to take temperature checks and how to scan tickets without touching people or their tickets.
Hi, everyone. My name is Justine DeCotis. I'm from Boston Children's Museum. We reopened on July 17th. We had been closed since March 13th. It was Friday the 13th. I will never forget that date for as long as I live. Like many folks, we opened first for our members. So we opened, as I said, July 17th, which was a Friday. So we did a Friday, Saturday, Sunday member weekend. And then reopened for general admission the following Thursday, the 22nd. We're open only Wednesday through Sunday right now, which was a big change for us. We went from being open about 361 days a year to only the 5 days a week, but I'm sure that's common with other institutions as well. I feel like I'm jumping into the next question about features of reopening, but so much overlap, I think that's okay. We're open in 2 time slots each day. So we're open from 10 to 12:30. We close, do some cleaning, do some swapping out of pieces and toys in our exhibit, and then open again from 2 to 4:30. Right now we're allowing 200 people per each of those time slots, which is actually less than 10% of the capacity of our building. So we're still quite low in that regard. We are allowed by the city and the state to have more, but we're just not comfortable with that yet. We are fully indoor. We do have some outdoor space that we can use for programming, but and allow people to spread out, but that's not a main draw for us. We are an indoor facility, so.
Well, that provides a perfect segue to the next question, and which is, what are some of the features of your reopening plan? I
can just keep going since I provided that segue, I suppose. So the 2 time slots is one of the biggest features of ours. And one of the big things that we do, because we're a children's museum, our exhibits have a lot of what we call loose parts. So the loose, not the exhibits themselves, but the loose toys and things that are in the spaces. So our pretend kitchen has all the fake food and the pots and pans and things. So one of the things that we do in between those time slots is we swap those parts out and put a fresh set. So we have 4 sets that we rotate through. So we use 1 in the morning, 2 in the afternoon. The next day we'll use set 3 and 4, and then first set comes back out again after 2 days. I mentioned our capacity already. Like many folks, we pushed and moved towards online reservations and online ticketing. We do still allow walk-ins when we have the capacity to do so. So if someone walks in the door and isn't aware that they needed a reservation, if we have space and they want to come in, we still allow them to do so. And of course, lots of surface cleaning throughout the day when visitors are in the building where appropriate, and also surface cleaning in that middle time from 12:30 to 2. Pass it off to somebody else.
Some of the highlights of the measures we took are temperature checks for every visitor and every staff person, masks for everyone, and also we're doing COVID testing with 4 staff who are in what are considered more at-risk positions, where you're either have to be in a mix of a lot of staff members every day, or if you're dealing with the public on an ongoing basis. And there are some who are older, so we consider them more at risk for their health. And the museum is got funding to pay for 1 test per week for these designated staff. And we also add more people to that when we need to. We just, in the middle of a pandemic, among hurricanes and other things, we implemented a new ticketing system. And the go live, we had to do a lot of training and to mix staff who don't normally work together. And so we did some one-off testing there. And it's been a nice kind of a reassurance.
For us, we made all of our ticketing online and in advance. You can still do same day as long as we don't have our sell up for our capacity. We also went to credit card only. We're in a county that does not say that we have to accept cash. So everywhere on property is all credit card. So we've limited any interactions there, moved all of our check-in facilities to outdoor spaces to keep everyone separate. Mask required by everybody, no matter inside or outside, which is also challenging. We started with a one-way path through entering the gardens and exiting the gardens, as well as the house. It used to be kind of more of a free-for-all. When designing our one-way path, we chose the longest route possible around the house to help spread people out. So get rid of any of our pinch points and limit any areas that have two-way traffic. Also, we did spray chalk arrows on the ground, since we are outdoors in areas that we want people to know which way to go. We used Rust-Oleum has a spray chalk, so it's not a permanent thing, especially since we have historic pathways, the brick, and we want something that wouldn't stain. But also, if we found the path didn't work, we could wash it off and start over. And we actually debated about time tickets for our site and our guests. It actually doesn't work for us because we got a big crash at those times. And since we do only have the one area, we just turned it into a come anytime during the day entry, which has worked well for us this time. Although the time ticketing does work in other places really well.
At our site, the core experience that people expected is so free form and so hands-on. And because the site is so large across a geographic area, it relies on trams. And so we did some before we reopened at all, thinking about what our highest thresholds were, like where were those pinch points, and things like tram transportation was going to make or break it. And just running the numbers on in order to keep the social distancing and the number of trams. Oh, we can only have 6 people total on an entire tram. Well, that doesn't make financial sense to run the trams. And so we kind of drew ourselves this box of, this is the sandbox we have this season, and we know it can't be what we want it to be or what our guests expect to be. So what can we do in the box that's really different? We spent a lot of time talking about essentially like the brand, that experience brand, and how do we make sure that they don't come and experience Old World and go, oh, is this what it is? It's not what I thought it used to be. Oh, they're really not doing well anymore, without realizing that, you know, us going, oh no, it's because of COVID. So we don't really like to be this way. So we wanted to create something that felt different enough that it wouldn't be confused with the regular thing that we obviously want to get back to and keep pushing forward with. So we looked at a lot of small group experiences. We looked at small groups that not only would be kind of that COVID proof, because depending on what numbers and what capacity, like we need to be able to offer this tour regardless of whatever lawsuit is being filed in the state to allow different size groups. And so we looked at groups that already had their own social contracts, which is the terminology we were using in terms of they'd breathe each other's air. So friends and family groups and small pods, and finding what kind of experiences, behind the scenes type things that they would pay for that exclusive experience. They would pay, like put a price on that safety of knowing that they wouldn't have to worry about other people. So mapped out a bunch of programs like that. We have masking as a requirement for all staff, but when we initially reopened, there were lawsuits at the state level making it illegal for us to require masks of guests. But then we were able to seek, I forget the technical term, but essentially a loophole in it that allowed us to say, no, you need to wear masks. So we do have that requirement in place now. And because the groups are self-selecting and they're choosing us because it looks and feels safe, that's part of the new summer brand. We haven't had issues with enforcing the masking, but it is, we don't take temperature checks or anything like that, mainly because of the political climate and the enforceability of it.
Right, so I feel like I'm going to take the next 2 questions, kind of combine them, because I feel like we've all touched on it a little bit in the answers to that last question. So to what degree have the new health protocols changed the nature of your work or the organization itself? And how has all of this met your expectations? Like, what surprises have you encountered? What have you learned from this?
I'll just do the jump in thing. Yeah, just to keep going with
I realize
it.
I'm looking at folks, expecting them to answer, and it doesn't, you know, your screen's different than mine.
Well, I'll tell you, Pat. No, so one of the new things that we created because of our ever shifting guidelines, so it's not even a restriction of health guidelines, it's this moving target, was this drive-through experience. Where folks kind of came in their car, and we've never let people drive around the site before. They're not even real roads, they're gravel, so we weren't sure what they'd think. But we finally said, we have to try it. We have to do something different. And the biggest surprise, I mean, people loved it, which is great. That wasn't a surprise. We knew they would, but the accessibility that it granted guests, and hearing directly from people about, oh, well, we love this place, but we haven't come for 20 years because I can't get on and off the trams, or the buildings are too hard to get into, the thresholds and the old floors are difficult, or it's just too long. Our average dwell time for a first-time visitor is 6 hours. It's an all-day thing. And then the price point of, oh, we have 6 people, $20, $20, $20, $20 plus lunch because you're there all day. And so there were financial and physical barriers that we just took for granted. Like, well, that's how long it takes. Well, that's the ticket cost. We're worth it. And so when we completely shook the table and crafted this new drive-through experience at $20 a car, we heard instantaneously from guests about how accessible the site now felt to them. And so that gave us just this huge thing that we're going to lean into and think about how this new landscape, this new COVID landscape what are we going to take from it moving forward? So it's a huge surprise.
Yeah, I'll jump in. As far as meeting expectations, I think we've exceeded our expectations. We really didn't know, is anyone going to come? But is all the staff going to feel comfortable? Are they all going to want to return? And it was a great response there, but it added, okay, who's going to check the hand sanitizer stations? Who's doing this? We've already, facilities team or cleaning teams, they're already cut back as well. So it's kind of a sharing the duties. I know we've had that other duties as assigned, and basically bringing that for the whole organization, and everyone just getting their hands together. Everyone's been weeding. And we are going into our holiday season and decorating, and there was a question about volunteers. We actually used this time we're redeveloping our volunteer program. So the volunteer program, where we had about 1,100 volunteers, was completely suspended for about a year. But that's kind of what we've done here, and also using this as like a silver linings time. What can you do? We raised our ticket prices during this time, but we also expanded Museums for All, which is a free admissions program for people with SNAP benefits, and just making the changes and getting full buy-in from the directors, the CEOs, all of them, and just taking this time to reevaluate everything we've done. Like you were talking about with the trams, is it worth doing? Can we bring cars in? Just take that time to stop and say, what are all the possibilities? What can we do with what we have, and what's going to be the return? And just take the time to try new things. And everything that we've kind of done is kind of worked out. We've done restoration projects in the house where when the house was closed, it's like, well, it's closed. What can we do? Well, we still have a curator who's getting paid, and she wanted to always work on this area. So give her the tools and resources to do that other work that would be more cumbersome in a non-pandemic time. So expectations have been great, greatly surpassed here at Filoli.
All right. Does anybody else want to weigh in on that before we move on? Okay. So there's a bunch of questions coming in the chat. I'm going to try and integrate them with some of the questions that we sent you all ahead of time. And in particular, I want to focus on staff right now. I want to talk about how you're caring for staff, how you're caring for yourselves, measures that are being taken to support the well-being of everybody who works there. In the chat, they're asking if the staff could come back at the same time, or is some staff still working remotely. So anything you can tell us about staff and volunteers and their interaction with this whole process.
I'll jump in again. When we first reopened, we were actually, when the COVID cases were actually increasing in our county, even though, you all been through those different things. It's time to reopen, numbers go up, numbers go down. But we took the time just to debrief. I myself, the night before, felt fine, but that morning you just kind of feel a little extra stress. Are we going to have 1,000 people come through today? And we haven't been open for 6 weeks, and I haven't seen half my team for 4 weeks. Just venting it out before everyone came in, just letting everyone know, hey, if you need a minute, just let us know, rotate out. We also had wildfires, smoke, where we were closed for smoke things. So just showing, the care. If it became hazardous or you weren't feeling safe, just, go home, take a minute. We had a COVID protocol our HR sent out. So if someone was feeling sick, everyone knew the steps to take. They knew what to expect. It wasn't a surprise. It was, first you're going to go home, and I'll send an email. And here's when to come back. In some cases, we were definitely overcautious. We had no cases, but they were out for a week, and it made the staff who was there know that we're caring for them as well as our own safety. And if I can't make them feel safe, it's hard for us to make our guests feel safe.
And for us, if your job doesn't require you to be at the museum, then you're working from home. So quite a number of staff are still working 100% from home. And it's definitely been a learning experience, but it's also helped us in ways We had to close for a day because a hurricane was coming this way and we weren't sure of the impact. And it was easy where before nobody would be working. Now everybody was still working because we were all set up to work either from home or at work. I work 2 days home, 3 days in person at the museum. Most of the guest service team is here most of the days in person. Couple can do work, you know, when you have to do paperwork, you can do that from home. It's a mix. And what's been helpful is I mentioned like the COVID testing. We get an email every week with status. Hey, we tested 150 people last week. No one's been positive. Or if we have a positive case, we know that they haven't been in touch with any other staff. That's been part of the protocol for a while. And I don't know when everybody's going to be back, but I suspect even when COVID goes away, when and if it does, we'll still have days where we'll work from home because that's how we're more productive and more comfortable these days. And we were lucky, we got to keep all our staff who were regular/permanent because we had an emergency fund that helped out with that and some donors that helped out with that. So it's been interesting going through waves of challenges, and the staffs, you know, it's a team. You may not see other people so much anymore, but you got to know them in different ways. It's hard on guest services to feel like you're the department that always has to be there in person when someone else may be sitting at home baking bread. But I'm just, you know, most of us are just grateful that we still have this opportunity to have a museum open and welcome guests. And we don't have volunteers back yet. They tend to be older, so in a higher risk capacity, and we're just not ready for that yet. But we are hiring temporary staff again for the first time for the opening of the new building. So we're adding staff. And that's a little bit of an interesting thing to wade through because now you have 20 strangers coming into a mix of your cohort who you're comfortable with each other and understand each other and how to interact. Now we have some strangers in a sense coming on and who you need to feel safe with.
On the heels of what Neda said about the guest service staff frontline teams, like, we still have to be here. That's been, we already as part of our training before this were very like, person first focused. Like you're people, you just happen to work in a museum. You're not just museum people, and just being really attentive to that, and you know, the check-ins, how are you feeling? Not how was your day at work, but how are you feeling? And so we made a really conscious effort to forefront all of that. But I'm not gonna lie, it was and continues to be an incredibly difficult cultural gap with people who can work from home and the people who have to be there. And not just the frontline folks for when we're open for public programs, but you know, the ag team, you know, because we have animals and they need to be fed every day, and the plants keep on growing, you know. And we've just had a lot of conversations about visible versus invisible work and trust with the larger team. That how do you build that trust when 3/4 of your team is not visible and or not doing work that is visible? And when others get really frustrated, the natural reaction of anybody is to feel like I'm working harder than anybody else, when in reality, we are all busting our butts equally, but you can't see it. You don't have those water cooler moments, those, we call them Keurig moments. Like we don't have those touch points. And so that's been really hard. And so we've just talked about it. Like we haven't solved it, but we're just acknowledging it and like calling attention to the fact that, hey, Jason, you're doing this project, talk about it, because it's this digital learning initiative that the rest of the frontline team wouldn't know about, but we want to shine lights on all these things that people are doing. So no one feels like they're fighting harder than anybody else. It's been hard.
Yeah, we've had a lot of the same kind of struggles. I work in the museum 3 days a week. I work from home 2 days. The rest of my visitor experience management team is here 4 days, home 1 day. But our floor staff is here, you know, if they work 5 days for us, they're here 5 days. So that's tough. And then as you go through the rest of the museum, there's folks that are here once a week. There's folks that are here once a month. So there's a wide range. One thing that I have always tried to do, but especially lately in all of this, everything is when folks in other departments of the museum get positive comments about what we're doing, I ask them to not just share that with me, but pass it along to the staff themselves. You know, I can thank and congratulate my staff, and my other managers can do that, you know, every day, all day, which is what we try to do now. But when it comes from a different department or literally a different voice, sometimes I think that shows that the rest of the museum has an appreciation for what they're doing. Someone in our development department just today spoke with someone on the phone who has been making small but frequent donations on our site whenever they buy tickets. And that person just had some wonderful things to say. And she sent an email that went to the whole museum to congratulate our floor staff. And just when it comes from somebody else in a different department, I think that always has a different value than if they're hearing it from me. And they hear it from me every day, and hopefully they appreciate that too. But when it comes from other folks, whether it's our marketing department or development or one of our VPs, I think that has an added value. So if anybody ever tells me something, I say, can you put that in an email and send it to everybody? I think it's a small thing, but hopefully it makes a difference.
And hopefully that starts a new practice that continues as we evolve into whatever comes next. So I'm going to switch gears a little bit here and throw another two-pronged question out. And this is to be mostly about guest interaction. So kind of combining one of my questions and a question from the chat. Ruth had asked about balancing access for all, especially when it comes to digital and time tickets, and that creating an additional barrier if somebody doesn't have internet access or something along those lines. But in addition to the different access points and how they've changed, like you mentioned with Old World Wisconsin earlier, and how more people were able to enjoy it with the ability to drive through it. On the flip side, to what degree have you experienced pushback from guests about some of the new health protocols or any protocols that have come with this reopening?
I'll address the end of the second part of your question. We had a tiny bit of pushback from a couple of people, let's say, about the masks. But for the most part, it was seamless until more recently, where we've got a couple, you know, it went from maybe 1 complaint a month to 2 last week. But it seems to be more a symptom of people are just tired of the whole thing and questioning why they have to wear a mask at all. And that's not really something we can answer for them. But it's been an interesting shift. I thought it would be hard in the beginning and get easier, but you have a little bit more pushback now. But what's helped us very much is we have free masks to give out to people who show up without. We also have face shields for people who say they have a medical reason for not being able to wear a mask. We have children and adults. So it was important to have another solution, and that helped our frontline staff quite a bit to have options they can offer people.
Yeah, definitely just a handful of the people who think that it's our job to make sure that the mask is doing it. It's really, you know, it's the county, it's the state, whether we agree with it or want to have those conversations. We just let them know this is what we have to do to be open. In our county, there's a fine system where if they get caught, they could get a penalty, but the penalty essentially, if we get reported, falls on the organization. We can, you know, we're all struggling with our budgets and we're running deficit budgets. Even with increased visitation, there's still expenses, and, you know, we pay that fine. And just kind of having those honest conversations with them has been, okay, well, what do we do? We've only had to remove 2 different groups of people. We just refund them, you know, hey, it's obviously just not going to work out. If I'm drinking water, eating, I don't have to have my mask. So they just sit there, they're thinking, oh, I'm drinking. Well, if you're walking around next to everybody, unless you're really doing it, you know, don't use it as a crutch. They're not comfortable. You're here for 90 minutes. Me and my staff, we're here 8 hours plus, and we're required the whole time to leave those on. I get the benefit of, I do have an office, so I sneak in, try to get as much extra paperwork done so I can get that extra breather. But we just kind of have areas where staff know, hey, if I need to take it off. But it's really been the mask of been the thing. We've had people where we've upgraded a fencing area to help guide visitor flow in the front. And guests were saying, this should be free. What are you doing? This is a historic site. You're ruining the views. How do you feel as a person? And it's like just separating everyone and doing, I think the main thing we keep saying is treating everyone as human is the goal. And, you know, not filing into the, I'm going to fight back. Just, you know, show like you're kind of breaking down, just bring it to your lower level and let them make the scene. Other people will see it. And we've had other people say, thank you for doing that to us. But that's kind of what we've dealt with that's different than we normally would have had.
It has been interesting to see the, oh, we thought it would get really hard. And then, you know, we'd get to muscle memory of how to engage. But to Neda's point, like, we're getting tired and the public is really tired, this whole thing. So like, it's not more or less problems, it's just different. We spent some time looking at other really big industries. So like the attractions industry for how they were handling masks from a guest service perspective. And places like Disney actually have like mask break areas. So it's like a little out, it's, you know, they have like the little smoking nooks that they used to have. Well, they still physically have those spaces. So now those are like mask break areas where you can step off to. So in these longer guided tours that are more than 60 minutes, we planned little areas where we knew folks would have a minute where they could spread out, take their mask off, and we tell them ahead of time, hey, we're gonna have this break, so don't worry about it. Oh, we know they're uncomfortable. So kind of very much that positioning of like, we're with you. This isn't awesome, but we're gonna make it work. I just think one other thing is it's been really interesting to hear our site reflected back to us by our guests in terms of what their expectations are. Some of the other sites that have outdoor and indoor spaces, the complaints have been like, but you guys are outside. And well, no, all the interactions are inside, but their memory is of all of the outside connecting spaces. And so those expectations of, well, why should I have to wear a mask? You guys are 100% outside. And we're going, are we really? And so it's just been interesting to hear our experience reflected back to us in this new context and using that as a marker to move forward.
Our biggest trouble with masks has not surprisingly been the young kids. And what made it a little challenging for us is Massachusetts put out a couple of conflicting messages on the age of masks for kids. There at first it was 2 and over, and then the governor released something that said 2 to 5. It was at the discretion of the caregiver, and almost up to the 11th hour of our reopening, we were going back and forth a little bit on which we were going to do, and we ultimately went with the 2 and over because given the population that visits our museum, if we did not require them for 2 to 5, we could be in a situation where half of the humans in our building are not wearing a mask, and that was something that we weren't comfortable with. So we are requiring them for 2 to 5, but we have been comfortable making exceptions either for special needs or other accessibility type reasons. We actually have stickers that we give visitors that say, we're going to change the wording. What they currently say is, I can't wear a mask, but thank you for wearing yours. What we're going to change them to say is, I'm still learning to wear my mask. Thank you for being patient. And the reason we're going to change them is that we find that we're using those stickers mostly with like 2-year-olds and 3-year-olds. And it's not necessarily that they can't wear the mask the whole time. It's that they are still, as I said, still learning to wear it, and they pull it down or they take it off. So by changing the wording on that sticker, we're hoping to change a little bit of the expectation with the adult visitor that's with them and say, well, you're not completely off the hook of the child wearing the mask. It's a do your best, do what you can. If they can wear it for half of the visit, that's certainly better than none at all. So that's why we're going to change that that wording on there, and that just gives our staff and our other visitors the heads up that first off, a manager has had a conversation with that visitor. And also just gives a heads up that, this child is still learning to wear theirs. So if we see it slipping below the nose or we see it falling off, we can, observe a little bit more before we, jump right in on the reminder to wear it or that type of thing. And that has overall works pretty well for us. It's hard once you start to make exceptions, as everybody knows. But so far it's been a good system.
Having worked in a children's museum, I cannot imagine this year in a children's museum. So we're running a little low on time, so I want to get this last question in. What is your contingency plan if you learn that either a guest or an employee has had a positive test that has COVID-19?
We have a return to work committee who started this whole planning to reopen, and they're still active. They meet weekly, and with HR's lead, they've put together protocols for all of this. One of the things my department's doing is we're trying to keep people who we can spare. Our group salesperson, who's also an admin and does other work, he's on campus 1 day a week. He's our spare in case us other two managers happen to get infected or quarantined. Then we have a backup who doesn't really interact with us in person. And just frankly, last week, one of our managers reported that they may have been exposed to someone in a family situation, not at work, who had tested positive, and we immediately shifted and brought somebody else in and sent her home to work from home. And it was shockingly seamless because we're all used to working from home now, and we had assignments for her, and we could easily change up our schedules and bring in my spare person, essentially. And same with other departments, you just have kind of your backup plan. And I don't have a plan for what happens if the entire department, it's something I've thought about, but not, it's nice that people self-report, because this person took the initiative, as everybody's been encouraged, to say, look, I don't think I'm sick, but I may need to quarantine, and HR followed up, made sure she got tested twice. So there's protocols for when a person can come back as well. And it was nice not to be in a guessing game.
Yeah, we've got the back to work team as well. I think normalizing that reporting, so even if it's not like a legit, oh my gosh, I have it, but hey, one of my daughter's teachers over the summer tested positive. And so I went into self-quarantine, just kind of modeling I'm still going to do my job. I'm still going to be here, but this is what it's going to look like. And just doing a lot of really intentional cross-training. So on those floor programs, that we have other folks who know that the expectation is that we're all going to step in and be there for each other within reason. We did have a sister site. There's 12 sites that are part of the Wisconsin Historical Society. They did have a guest that tested positive and then told them after the fact, after they had been in a group tour situation. So it was one of those, thankfully it wasn't us, Schadenfreude kind of things. We got to watch the process play out at another site, and it worked. And because all of our programs have a pre-registration component, if there is a contact tracing element, we have all of that in place. So that for our frontline staff is kind of this, it's not a safety net, but it just helps know that there is that support system there. If something were to happen, we've got the data to back it up and move forward with the plan.
All right. Perfect. My timer was at 10 seconds. That couldn't have been better. So I want to thank you all for sharing all of your experience and wisdom with us. As you probably saw in the chat, Jason had to go address a medical emergency because when you're running visitor services, you got to run at the drop of a hat sometimes. I'm sure we've all been there. But yeah, thank you so much for all of that. You can keep, if you have any more questions, feel free to throw them into the chat. We are going to stay in this room. The other session is wrapping up. They're going to join us in here, and we are going to wrap up this experience. So we're going to give them a few minutes to pop in. But if you have any other questions in that time, I can definitely get to those now if you like. Also, if there's any questions I missed in the chat, I made my chat window bigger, but I think I may have missed some. So you can feel free to unmute and ask if you like, as other folks file in.
And I'm going to put my email address in chat. So if you have a burning question you want to ask at a later point, you're welcome to email me.
I will do the same.
Just as a former visitor services manager at a children's museum, I have to ask Justine, you said you had 4 sets of, we call them props, but
yeah,
that you rotate out. Did you always have 4 or did you add some for this?
No, we had one set that stayed out on the floor, and then we obviously had like restock and backups, but the 4 sets is new. Okay. We were able to, in some instances, we decreased what was out there. So in some spots, we were able to like make our 4 sets out of the one that we had. Obviously, with fewer visitors and just trying to keep up with the cleaning. In some instances, we wanted to do lower, but yeah, the 4 sets is new.
Okay, it makes me feel a little better. All right, double check here. I'll still give people a few minutes to go back in.
Sorry about that. She'll survive.
Okay. That is such a perfect like visitor experience moment.
Yeah, no. Yeah, no, good quality staff. They stepped in, pulled the other emergency response person in there, and 911 will come and take care of it.
It's always something in this job.
But at least everyone in this conference would understand. You probably can relate.
Okay. Yeah.
There's a question here in the chat about essentially a cleaning procedure, or are there other kinds of organizations that close down to clean every day?
We don't close down to clean, but as an art museum, we're lucky you're not supposed to touch anything. So we have extra housekeeping staff who are constantly cleaning handles and elevator buttons, that sort of thing.
Our super high touch, not children's museum high touch, but the added complication of it's all historic surfaces, so I can't just like take Lysol to it, or my curator will have my head. So we spent a lot of time looking at what are the proper cleaning protocols, but also, again, just changing that framework for the engagement for the guests so that it's just not the same, but giving them an out, like giving them other things to touch, like a new tour that involves, it's like a choose your own adventure where they have to roll a dice to choose what happens. Well, that means all we have to do is clean the dice, as opposed to the 17 other things they would normally touch in a space. So it's been a gracious redirect of some of that hands-on engagement to wipe offable surfaces that we can do between tours.
What we've done is we've set up a couple just cleaning station areas. So our cleaning staff will go through to restrooms and takes care of our visitor center. They clean the historic house at the end of the day. But we have our staff is responsible, our check-in, after each person switches their rotation, they're responsible for cleaning their space. But then when you go to shift 3 times through the day through the garden, we have different supplies based on the same thing, historic. You can't just go around with Lysol. So kind of trained everybody with what supplies can use where. And as they're going through, they'll kind of do a cleaning thing. So it's getting done, but it's also a visual for other people to kind of keep a reminder that, yes, we are in this time. Ironically, we did add a piano to the garden. It was actually for our picnic style gala that we did. And people ask, is it being cleaned? And we're not cleaning that. And it's just clearly stated on there, this surface is not being disinfected. And we leave that up to the guests to decide the level of risk they're going to take. It's not a historic piece. It was just a donated piece, and it takes work to get it in. It's going to take more work to get it out. So it's just kind of sitting there right now. And we just kind of put a hand sanitizer station near it. So it's not that we're being completely negligent, but allowing the guests to really figure out what they're comfortable with. So that's kind of our cleaning.
All right. Well, it looks like we got a good amount of folks in from the other session. So I just wanted to thank everybody for joining us for Reimagining Experience this year. It was quite a ride. I mean, we made the call in very early April to go online for the conference this year. And I thought, you know, great, we made the decision, we're good to go. And the amount of other little decisions that came along with that, and the amount of changing of plans that we encountered along the way was really something. So I want to thank Krista and Dan and Nicole and Cindy and Kyle and Tiffany for all their work, all the ambassadors who helped us out from around the country. We really have a great group of people that put this together. I want to thank Gateway for being our presenting sponsor. We could not do this without them. I want to thank Social Good Software for sponsoring both of our keynote addresses. And on that note, I'd love to thank Seema and Adrian for giving 2 really incredible keynote addresses. It was wonderful to hear from both of them. And it was also wonderful in this format to be forced to go into the sessions. Normally, our crew is planning this conference, and by the time we get to the day of, we're barely standing and can find us in between sessions. We're just spread out around the info desk. So to actually be able to engage and involve this year was really fun, and something I know I'll try to do more in the future. We have more stuff coming up. We have our VEX Ed webinar series. The next one is going to be Tuesday, November 10th, not the 12th like I wrote in the program, but the 10th, because the 12th is a Thursday. So Tuesday, November 10th, we will have Dr. Andrea Braverman, who is a clinical professor of psychiatry at Thomas Jefferson University. She has been doing a series of talks throughout the year on coping with COVID. We are broadening that a little bit to coping with 2020. There's been a lot thrown at everybody this year, and I'm sure there's gonna be a lot more thrown at us before we get to mid-November. So she's just gonna give some tips and tricks on how to take care of yourself and focus on mental well-being in what has been an interesting year. We also will be downloading all the videos and the sessions from this conference, and chat transcripts, and what I'm sure will be a very interesting closed captioning transcript. I've seen a few things in here that are, they get a lot of the words, but every so often there's just 1 or 2. But we'll make all that available to you soon. Look for an email from us coming out in the next couple of weeks. We're gonna follow up with y'all and get you some of that information in there. And with that, let me just double check, make sure I got all of my ducks in a row here. That I did. So with that, we are looking forward to hopefully seeing you in Cleveland next year at the Cleveland Museum of Art for our 10th annual conference. We never expected that the conference would grow this much or go this far, but here we are coming up on year 10, and we're very excited to hang out in Cleveland, see the Cleveland Museum of Art. We're hoping to do an event at the Rock and Roll Hall of Fame and do some other fun stuff all over Cleveland. So we hope to see you there. So thank you, everybody. Thanks for being a great group of folks to work with and share ideas with. And we will see y'all soon.
Thank you.
Thanks, everyone.